So for patients for aftercare, we have a department that's called our Ongoing Care Department, OGC. And what Ongoing Care does is they reach out to patients on a quarterly basis from the date that they were set up, check in with the patient, see how they're doing. If everything's going good, they ask them if they need supplies, and they let them know what the patient is eligible for at that time. You know, after we set a patient up with their equipment, we do a 48-hour follow-up phone call, check in with the patient, see how their therapy's going so far. Well, before they leave the appointment, we schedule a 30-day follow-up. And a lot of patients, when we see them come back at their 30 days, we download the SD card from the back of their machine, and we print out a report, and we go over that report with them, and we compare the report to, you know, pre-therapy, post-therapy. And a lot of patients, when I'm doing setups on patients, I will ask them, so why'd you do a sleep study? If they didn't do it with us, I'll ask them, you know, why did you do a sleep study? And they're like, oh, you know, I wake up every morning and I have these real severe migraines, and my physician thought that, you know, maybe it's related to obstructive sleep apnea. And so once I set them up, when they come back for their follow-up appointment, I'll say, you know, I said, you know, when I first met you, you were having severe migraines. That's why you did a sleep test, and that's why you went on therapy. Are you experiencing that anymore? And they'll say, no, not at all. I said, once I went on therapy, the migraines went away. And I'm like, great, we're making a lot of progress here. You know, so it depends on why the patient did the diagnostic study, and depends on why the patient went on the therapy. Some patients will go on therapy because they have excessive daytime sleepiness. You know, some patients go on for the severe migraines. Some patients go on therapy or are tested or go on therapy because their bed partner complained that they snore like a train, and you know that they're keeping them up, and you know the snoring's gone away, the daytime fatigue's gone away, headaches have gone away. So it depends on why the patient went on therapy is where I'll always start off the appointment when they come back for their follow-up, to see if those, you know, what they were experiencing before therapy is gone away. And then I'll always compare their download from the machine. Say, look, you know, when you were diagnosed with obstructive sleep apnea, you were at 60 events per hour. Your AHI was 60. Now on therapy, your AHI is 2. Well, less than 5 is considered normal. You're doing great.